Hello, viewers. So, today we are going to discuss something about carpal tunnel syndrome. Now, most of us have heard this term before, but some of us don't actually know what it means. So, I'll try to explain it in easy language using no jargon. So, carpal tunnel syndrome is basically a painful disorder of the hand which is caused by pressure on a very large nerve called the median nerve as it passes through a tunnel at the wrist. Now, this tunnel is formed by a tough membrane that makes like a roof or a natural arch produced by a group of wrist bones known as the carpal bones. The purpose of this membrane is to keep the many tendons, arteries, and nerves that pass under it in place. When this membrane thickens, too much pressure on these structures, especially the sensitive nerve, producing the symptoms. Now, looking at the anatomy of the hand, there are three nerves which supply the hand. One of them is ulnar nerve, the other one is radial nerve, and the third one is the median nerve, which is actually responsible for the carpal tunnel syndrome. Here in this diagram, you can see which parts of your hand are actually supplied by which nerve. So you can see here that the median nerve supplies the palmar aspect of your thumb, your index finger, your middle finger, and half of the ring finger. Now, these next three pictures will actually show you how the median nerve passes through the wrist under the transverse carpal ligament, which usually forms like a tunnel over the carpal bones of the wrist. Now, every nerve in the human body has two main functions. One of the function is sensory function, the other one is motor function. So the sensory function is related to the sensations. When you feel something, when you feel the pain, that is the sensation part of the nerve which transmits the signals. And the motor component of the nerve actually produces movement in the muscles and the joints. So motor is for movement, sensory component of the nerve is for sensation. Now, when the median nerve is affected by the compression in the carpal tunnel, the first symptom usually is sensory symptoms, in which patients can complain of tingling, burning, pins and needles, or numbness. And that is usually felt in the same area of the hand which is actually supplied by this nerve, which is the palmar aspect of the thumb, palmar aspect of index, middle finger, and half of the ring finger. Now, if this compression stays there for a long time, or if the compression is severe, then it will start affecting the motor function. And people can drop objects, they will have weakness in their hands. The symptoms of carpal tunnel mostly happen during the night time, and when the patients wake up in the morning, that's the time when most patients will feel most symptoms. And the reason is because when we are sleeping, subconsciously and inadvertently, we usually flex our wrists, and that is the position in which the pressure on this nerve increases. Now, how is it diagnosed? During physical examination, the patient is asked to flex their wrists, just like in the picture, and to keep the wrists in this position for 30 seconds to 1 to 2 minutes, and the symptoms are reproduced, and that usually confirms the diagnosis. Then, investigation wise, ultrasound usually start with an ultrasound. Might need to do an MRI scan, which is a bit expensive, and nerve conduction studies. They are the definitive diagnostic tool. The nerve conduction studies, in which they try to pass the current through the nerve and then they measure the velocity of the nerve conduction. Now let's come to the treatment. The easiest treatment, which is non-invasive, which does not include any operations, is to wear a splint like this. There are lots of different companies making the wrist splints for carpal tunnel, and you can choose the one which is the right size for you. Basically, the principle behind wearing the splint is that there is a metallic rod on the palmar aspect of the splint, and that stops your wrist from getting flexed subconsciously, especially when you're sleeping. So these splints are usually worn at night time when the patients inadvertently or subconsciously flex their wrists. During the daytime, you can opt not to wear them. If these splints are not working, then you can do some exercises as shown in the pictures. If these exercises don't help, you can ask your doctor to send you for an ultrasound guided steroid injection, which is usually a mixture of local anesthetic and cortisone or steroids. So the local anesthetic helps with the pain of the injection and also numbs the pain and numbs the carpal tunnel symptoms for the first 24 to 48 hours and gives some time for cortisone to kick in. Now, the cortisone, which is a steroid, works under the principle of reducing the pressure, the inflammation, and the swelling around the nerve. Ultimately, if the injection does not help the patient, then they are referred to hand surgeons or orthopedic surgeons, which then cut that ligament which makes the tunnel, which is actually producing the pressure on the nerve. So they divide that membrane or that ligament that relieves the pressure from the nerve as shown in these pictures. I hope you found this video informative, and if you like this video and my other videos, please do subscribe my channel. Thank you.